Welcome to the Med Spa Method. My name is Leslie Schweitzer, and I'm a doctorate-prepared nurse anesthetist and the owner of Real Aesthetics and Wellness. This show is your guide to navigating the med spa world with confidence. I'm going to talk about the treatments, the trends, and how to find a provider that you can trust. Because when it comes to your health, your face, and your results, there is a right way to do it. If you could reverse sun damage, fine lines, and texture in one treatment, would you do it? What I'm talking about is erbium laser treatments. It's one of the most underrated resurfacing treatments, and I think that's because, at least what I've heard, is when people think of laser resurfacing treatments, they think of the very aggressive CO2 lasers, which come with a lot of downtime, and they don't even want to look into any other laser. So I wanted to bring today's topic, erbium laser treatments, as a way to share with you a solution, which is a gentler treatment than a CO2 laser. You still get phenomenal results. I've been doing these treatments for 2.5 years now and just blown away by the results. I've had them done to myself and plenty of my patients, and I just absolutely love this treatment. So erbium lasers are targeting water in the skin. Whenever we're talking about any laser treatment, we talk about what it's targeting because that's the type of result that we're going to get. So sometimes we talk about targeting pigment, whether that's melanin or if that's hemoglobin. Other times in this situation, we're talking about targeting water because that's what's on the surface of our skin. Those skin cells are mostly made up of water. So by targeting them, we are resurfacing or pulling off the top layer of the skin. So this is removing that damaged outer layer of the skin and allowing fresh new skin to come through. So in comparison to something like a chemical peel, with an erbium laser, we have a little bit more tighter control. Chemical peels, they tend to react a little bit differently on each person's skin, and so the number of layers that we're applying is kind of based on their tolerance, where with erbium laser, we can kind of set the dial, and I feel like it's just a little bit tighter control. Both are a form of resurfacing. We could also compare an erbium laser to microneedling. Microneedling is going to put small little punctures in the skin to stimulate a healing response and new skin versus actually ablating or partially ablating that top layer of skin with the erbium laser for new skin. And like I said before when I talked about CO2 a little bit, CO2 is going to be a more aggressive treatment. It's going to have a little bit more downtime. It's still going to resurface the skin. It's just going to do so in a more aggressive fashion. Sometimes when I say erbium laser, my clients don't know what I'm talking about. But if I use one of the name brands like the Halo laser, which is a combined technology with erbium characteristics, then they seem to understand what I'm talking about. So if you've heard of a Halo laser, that is an erbium laser treatment. So what does it treat? The erbium laser is going to treat fine lines and wrinkles, which is going to be that very top layer of what's on your skin has those fine lines and wrinkles in them. It's especially effective around the eyes. In fact, we offer at my medical spa a separate treatment just for the eyes so that we can target those fine lines and wrinkles just around the eyes, even offer some skin tightening around the eyes. It's also going to treat some degree of sun damage or overpigmentation. When we're talking about that type of sun damage, we're talking about pigment that is on the top layer of the skin versus deep dark pigment, which is deeper and deeper layers of the skin. One way we can kind of tell the difference here is that When a pigmented lesion is deep within the skin, it's more of a solid in appearance, and when it's closer to the surface that we could pull off or burn off with an erbium laser, it's gonna be broken apart and a little bit more patchy. Erbium lasers are also excellent for rough texture and kind of brightening and evening out the skin tone. They will help a little bit with acne scars. However, I would say that I would personally prefer a microneedling treatment to break up that scar tissue before we did an erbium laser. And it does help a little bit with enlarged pores and kind of shrinking up those pores a little bit. So, kind of overall, when we're talking about our overall results that we're going to get from an erbium laser treatment, is we're going to be treating that crepey skin, maybe smoker's lines, dull or uneven skin texture. That's really where an erbium laser shines. So, let's take a moment and talk about the differences between the aggressiveness of these treatments. Our laser that we have has two different lenses that can be applied. One lens is a fractional lens, which means that when it's fractional, it's got 35% of the laser's power is able to come through the lens, and the other 65% is blocked. And what that means for the patient is that 35% of their skin is going to be treated, and 65% of the skin is going to be healthy skin that is there as a guide for the skin that was treated to kind of follow and heal. So, this is going to be great for somebody who wants a lesser downtime or able to achieve brighter, more even skin tone, smaller pores, and improvement in fine lines and wrinkles with maybe only 3 or 4 days of downtime using that fractional beam. But if somebody wants even more aggressive results, then we're going to use the fully ablative or full power of the laser, meaning we'll put on a lens that doesn't block any of the laser's power. We're going to use 100% of the laser's power in that treatment, and that's going to be even better for fine lines and wrinkles, even better for pore size, and even better for brightening up the skin's texture because we're going to treat 100% of the patient's skin. Now, even with those two differences, we could still have a wide variety of treatment downtime, meaning days that you wouldn't want to be out in public because your skin might be a little bit brown. It could be a little bit flaky and dry, and in the beginning, even red and swollen. So that can really kind of vary based on how high we turn up the laser. So if I have somebody who comes in and they've never had a laser treatment before and they come in and they say, I'd like to have a CO2 laser, I'd usually talk through the options with them, and we usually end up trying out a gentler fractional erbium treatment first before launching them into something aggressive like a fully ablative erbium treatment or a CO2 treatment. And that's because I want to see how their skin reacts, and I want to see how they react to having treated skin. And I want to see that they can be compliant with their post-procedure instructions. So I'm going to do a whole couple of minutes, a whole little section on post-procedure instructions and post-procedure treatment, but that is a huge factor in how well you heal and how fast you heal. If I have a client who comes in and says that they've had chemical peels in the past and they are ready for a more aggressive treatment, now this is somebody that I might allow them to do a little bit more of an aggressive erbium treatment because they've had some resurfacing done in the past, but still not the candidate that I'm going to say, okay, let's go ahead and do a CO2. I'm still going to want to do an erbium treatment on them first and see how they react. And then when I have clients who have done a couple treatments before and they kind of know what they want, then I do let those clients say, I think I'm ready for a CO2 today, or I'm ready for a fully ablative treatment today, because they kind of know what they're going to get at that point. They know kind of how the healing is going to go for them, and they know how to follow the instructions. So what's the treatment like? Most of the time, we're gonna bring you in, we're gonna take your pictures, and we're gonna apply numbing cream. Now, the reason I say most of the time is because when this laser's turned down quite a bit, you really don't need to be numbed. It's really not uncomfortable, it's just warm. So I do have some treatments that I do that I don't even need to numb the skin for, and they're very well tolerated. During those treatments, it feels like you're being kind of tapped on the head, a and once that tapping is done, you just leave with feeling like you have a light sunburn. I have all my patients, regardless of how aggressive their treatment was, I have all of them go home and I don't let them put anything on their face until they don't feel hot anymore. And for most people, this is about 1 to 4 hours of waiting time feeling hot. The reason that I do that is I want the heat to leave their skin before I lock it in with any moisture. If you lock in that heat, then we're starting to risk, well, you could blister, you could have even more thermal damage just from locking in that heat. So you've come in, you've been numbed, we've done the procedure itself. Depending on the area and the settings that we're using, your treatment might take 20 minutes or maybe 30, all the way up to an hour, kind of depending on the treatment characteristics. And then you're going to go home and feel warm for 1 to 4 hours, depending on your skin and your tolerance of the procedure itself. And then you're going to go home and your downtime is going to begin. Now, I sort of talked before about how the fractional treatments that only treat 35% of the skin are going to have a little bit lesser downtime. Those people are probably going to be red for a day, and then they might peel a little bit starting on about day 3, and they're pretty golden and normal by day 5. But on those more aggressive treatments, they might go home and be red and swollen, and they might peel and be flaky for all the way up until day 7. And then all of that starts to come off and new baby skin comes through, and then you start feeling more normal around day 7 or 8. So that is something, the treatment characteristics that need to be discussed beforehand. This is not a lunchtime laser treatment. It's not something you just want to come in for quickly and then go back to work. I have plenty of patients who like to do that with their Botox treatments, pop in over lunchtime, get your Botox, go back to work. Nobody even knows you had anything done. That's fine. That's not a laser treatment. Another thing we should talk about is sometimes I like to stack these treatments. I like to use a laser treatment as like my finisher on the top of something else to make even better results. Probably my favorite way to do this is when I pair it with radiofrequency microneedling. And when I do that, the purpose is because the radiofrequency needling is breaking up that pigment that's deeper in the dermis and letting that come forward. It's also stimulating more plumping because it's getting deeper into the skin. And then the erbium on the top is like a finisher. It's pulling off any pigment that was on the surface, and it's helping immediately brighten the skin, and it's helping with those fine lines and wrinkles. And when you put those two together, it's beautiful. And we actually call that a vitality treatment at my spa because it really does make the skin so much younger and really turn back the clock and like infuse you with vitality in one treatment. Another treatment I really like to combine with an erbium treatment is an IPL. So I like to bring you in, do the IPL first. The IPL is targeting some melanin and some hemoglobin. And so that's treating some redness, that's treating some pigment. It's shutting down the redness, it's pulling the pigment to the surface, and then we can do the erbium laser on the top of that to pull off that pigment that was brought to the surface. The IPL is also stimulating a little bit of collagen, so it's going to plump the skin a little bit, and it leaves you with a very glowy appearance. So we call that a glow and lift. When you put the two together, we're going to give you a glow. We're going to lift off the pigment. It's a beautiful treatment when it's paired together like that. So now that we've talked about the different types of laser treatments and severities of erbium laser treatments and the different ways that I like to stack them, let's talk about what your home care is going to be like at home. So what we do is we provide to everyone a post-procedure safe cleanser, because one of the keys to healing well from a resurfacing laser is washing your face frequently. So you're normally probably used to washing your face twice a day, morning and night, and some people skip a cleanser on one of those. Well, on this healing journey, you're going to use a gentle post-procedure safe cleanser with just your hands in warm water, no washcloth, nothing exfoliating. Get good and foamy and wash your face gently. I want this to be done with your hands so that your hands can feel the texture of your face and not a washcloth. A washcloth is also a form of mechanical exfoliation. So we're going to use just your hands, soapy water, rub those together, make a nice lather, and wash your face 4 times a day. That's just a gentle exfoliation. It also feels really great. Once your skin has dried, then we provide our patients with a peptide and growth factor post-procedure safe serum that increases their healing, shortens their healing time, I should say, and nourishes the skin. And again, post-procedure safe is so important. So we get this post-procedure safe serum on your skin, let that soak in, and then we're going to do a top layer with plain, straight Vaseline. I know that's not a fancy product, but it's tried and true. It doesn't have a bunch of additives. It's just 100% white petroleum jelly, and that's what I like about Vaseline. There's nothing that's irritating. So I like my patients to use that for the first 3 to 5 days. And the reason I have to say 3 to 5 days is because I don't know how aggressive the treatment is going to be in this case, and I don't know how well my patient's going to heal. So I explain to them, while your face is gritty, while your face is feeling dry, it is. Let's lock it in with the Vaseline. Let's back up for a minute. Why do we need to lock it in with Vaseline? Well, with any of these resurfacing treatments, what we're doing is causing some evaporative loss, meaning we're heating up those cells which are full of water. Remember in the beginning we talked about that it's targeting water. So now we need to hold in any water that we have so that our face doesn't dry out. So we're combating evaporative loss from a heat treatment by holding it in with Vaseline. And we're going to keep up with that Vaseline until the grittiness is gone, the swelling is gone, and your skin is starting to feel normal again. That's when you're allowed to stop using Vaseline. And it's a little bit different for everybody. The way that you can get there faster is to drink water. So just as the water is leaving your face, we need to replenish it by drinking added water intake on the days that you're healing. So I encourage all of my clients to carry a water bottle around after having any resurfacing laser treatment done, just to combat that evaporative loss. Now, when we do those stacked treatments that are incorporating maybe the radiofrequency microneedling with erbium on the top, we also provide our clients with an additional product to help them heal the absolute best. It might be a peptide moisturizing spray or some growth factors, but we do provide extra skincare because their skin is healing from 2 treatments and not just one. So post-procedure care is incredibly important. I will hear from clients often, well, can't I just use my Cetaphil? Or can't I just use this e.l.f. product that I really like? And the answer is simple. No, it's not post-procedure approved. The ingredients that they have listed in there, their proprietary blends or whatever all their ingredients are not something that have been studied to be used on fresh, raw skin. So we're just not going to use them. We can't guarantee what those results are going to be like, and we can't guarantee that those are going to be safe. So we're not going to use them at all. We're going to advise against it and instead That's why we have chosen to provide our patients with the proper post-procedure care so that we can guarantee that they are getting what they need to heal properly after these procedures. How soon after having one of these procedures do you think you'd get a good result? Some clients want an immediate result, in 3 days. And those clients, what's going to be best for them is not to get an erbium laser if you got an event coming up in 3 days. That's going to be a better treatment for them is going to be like a red carpet peel, which is a very gentle chemical peel to make your skin very glowy, kind of overnight or the very next day. But an erbium laser, on the other hand, is something that we've kind of said you're only going to have 3 to 5 days of, even with a gentler treatment, 3 to 5 days where your skin's not perfect. So, in real change, in real honesty, we're going to see results in about 2 to 4 weeks. 2 weeks, we'll see all fresh, new skin. It will look glowy and the grittiness should be gone, and you should start noticing change. And by 4 weeks, you should definitely be healed. And then your next treatment, if you're wanting to continue doing more and more treatments to get better and better results, we advise that those be at the 6-week mark for most of these. Most of the time, we're going to be advising our patients to do approximately 3 of these treatments. 3 is a good number that I've found works really well for microneedling, for lighter sessions. But if we're doing more aggressive treatments, it might be, 1 or 2 treatments, and those would be further apart than 6 weeks just because of the aggressiveness of it. So that's sort of personalized based on how aggressive your treatment was. These should always be paired with the proper skincare at home so that you can maintain those results. We do, like I said, provide our clients with the proper skincare for their healing time, but that doesn't mean that it's all inclusive. You're still going to need a quality SPF. You're still going to probably want an eye cream or a neck cream or a daily moisturizer that's even more than what we've provided during the post-procedure period. So protecting your investment once you're home is something that we should also consider when we're talking about doing our next treatment. When we're talking about the treatment that we do at home, our everyday home care, we should also mention that there are a couple of products that if they're in your routine, you need to stop before having any laser treatments. And that's going to be your aggressive prescriptions for your skincare, like hydroquinone or tretinoin, any aggressive retinols. And we also have our clients stop using medical grade retinols or retinoids as well, 3 to 5 days before their procedure. Over-the-counter retinols are not really strong enough to change how the laser behaves, so it's not a huge concern, and that should tell you that it's not a huge benefit to your skin either to use one of those very weak retinols. But that's just my opinion. As far as SPF goes, I should mention that in the healing process, when I told you that I have my clients use that Vaseline until they knew they were ready to be done with it, till their skin is starting to feel more normal. After that, then I have them start using an SPF. Prior to that, it's very hard to apply an SPF and Vaseline at the same time. There are a few post-procedure safe SPFs, so if you're going to be out in the sun, you should definitely apply one of those underneath your Vaseline, wear a giant hat, but at the same time, you should just not go outside. You should just plan not to go outside and be out in the sun after you've had one of these treatments. It's just not the best time for that. So, as far as cost goes, would you rather do, this is going to be a personal question, would you rather do one aggressive treatment per year, or would you rather come in every single month and get a quality facial and gentle resurfacing, maybe by dermaplaning or by having a gentle chemical peel every single month? I do think that you can take care of your skin without doing lasers if that's not something that you want to do. But I do think that a once-a-year laser treatment is a wonderful way to care for your skin and to help with those fine lines, wrinkles, dark spots. It's definitely something that I like to do for my skin once a year. And in between, I like to do things that are a little bit more gentle, like a gentle chemical peel here and there, or a gentle microneedling session to keep my skin fresh and young and keep the pigment concerns at bay for me. For me, it's very important that I feel like I can wear no makeup. And I think that is maybe a little bit generational because I went through a part in my life, and here's just a personal part about me, but I went through a part in my life where I had to thickly apply makeup and I felt like I couldn't go anywhere without it. So it was a huge goal for me in my younger years to not feel like I had to put so much makeup on and cover up the acne scars and the overpigmentation. And doing treatments like this are what have got me to a place where I can either wear no makeup at all or just a tinted sunscreen as my only foundation. I don't even have a bottle of foundation in my house anymore. I just have my tinted sunscreen or my not tinted sunscreen. And sunscreen is an absolute must for me. So that part is going to be a little bit personal. We should also mention the skin types. I should have mentioned that earlier when I was talking about who was the best candidate for it and what we were treating. So let's just talk quickly about skin types. Skin types are often referred to as Fitzpatrick skin types 1 through 6, and that just is a gauge of how much melanin is in your skin. So the real fair folks are a Fitzpatrick 1, and the very darker skin is a Fitzpatrick 6. Anything with heat is not as safe for the darker skin tones because they have a higher likelihood of activating the melanin in their skin with that heat and resulting in either scarring, which could be a loss of pigment or overpigment. So in the right hands, an erbium laser treatment could be done all the way up to a Fitzpatrick 5, but I personally would not treat a Fitzpatrick 6. And instead, what I would do for those folks is I would instead recommend that we do something a little gentler, like a pico laser or some chemical peels that don't have any heat on them at all. I also, if someone came in with a whole bunch of acne scars, I briefly mentioned before, that's not the best candidate for an erbium laser since we're targeting water and it's on the top layer of their skin. I would rather that we do something to break apart the scar tissue like microneedling or a CO2 treatment is going to be better for those acne scars. So I hope that this discussion has been helpful for you in understanding what an erbium laser can do and how they should be used. If you have questions about if they're best for you in our area and you want to be treated at Real Aesthetics and Wellness, then you're welcome to book a consult. And those are no cost to you to come in and hear about what's going to be best for your skin and what your treatment plan would look like. And if you're not near me, then you should find a reputable medical spa that will talk to you about your skin concerns and map out a treatment plan for you. So I hope this was helpful. If you have any questions, you're welcome to put them in the comment box and I'll do my best to answer them. But erbium lasers are a beautiful treatment for fine lines, wrinkles, brightening the skin, and decreasing pore size. And I hope that you've enjoyed today's podcast.